Andy Barnes, and welcome to Caring for Arizona, your source for medical-related news and information from around the state, as told by the medical professionals, nurses, and doctors, caring for you, caring for Arizona. Let's get started.
My name is Shashir Shah. I'm the Medical Director of Wound Care and Hyperbarics here at St. Joe's. So often when we think of a wound, it has different meanings to different people. Before I was involved in the field, I thought of a wound as when I cut myself in the kitchen or hit a car door or maybe fall, or injure myself playing a sport or something of that nature. And typically we put a Band-Aid on it, some dressing on it. Maybe we go to Walgreens, get an over-the-counter antibiotic cream or gel, and hopefully it gets better by just washing and keeping clean. We usually do fine, even with very little care, probably not needing to see a doctor. But what we see is patients that have chronic illnesses, usually diabetes, they have heart disease, may have skin cancer, or may have undergone a large surgery or major surgery, or even a fracture. So those are complex cases where they don't heal on their own, they don't heal with a Band-Aid, or a simple stitch may not heal them up. If it's more than 30 days of not progressing actively, not healing and making good progress, or not closing down in the wound size or the skin size, then they need more advanced care. And we consider a lot of those patients who failed 30 days of conservative care, which is they've maybe seen their doctor, maybe had a stitch, or maybe just cleansed it on their own and bandaged it up, but have not improved. One of our biggest tools is hyperbaric medicine. Hyperbaric oxygen treatment is sort of the largest tool, a very effective tool, and a very unique tool. When we have an illness or an injury, often oxygen is deprived in that particular area. And our skin is very sensitive to oxygen because even though it's the largest organ in the body, it's often the last to get perfused because the body's priority is always the heart, the brain, and some larger organs internally rather than externally. What we do with this chamber, what the hyperbaric does, is gives oxygen under high pressure. Such high pressure actually delivers it through the body, through the lungs, and delivers it from plasma through the blood system to the skin, and allows the skin to go through a more normal healing process when it normally wouldn't. But when they go inside the chamber, it's really just sitting there for about 90 minutes to 2 hours, depending on the treatment protocol, and they can typically just sit there, take a nap, they can watch TV, they can talk to our techs that are in there. So our techs do go inside the chamber with them, so there's always someone accompanying them. And usually we have 3, 4, 5 patients at a time getting treatment. The type of wounds we can manage are diabetic foot ulcers, especially those that have severe infection that's not improving. People that have what we call osteomyelitis, which is a bone infection that doesn't get better with antibiotics and or surgery. Patients who have cancer have undergone radiation treatment. That radiation treatment can cause soft tissue damage, and so what Hyperbarics does is helps those patients as well. Also, if our patients have undergone skin flap surgery, if they've had some kind of reconstruction of a limb with skin flaps or skin grafts, whether it's for cosmetic reasons or mostly for medical reasons, these skin flaps, skin grafts often don't heal well because there's a lot of tissue edema and pressure, maybe infection, and poor oxygen perfusion. So this helps those patients quite a bit as well.
Now let's head into our next story.
Cataracts are clouding